Hello and welcome back to the Advancing Healthcare Innovation Show. I am your host, Michael Stamatinos. And if you're new to us, we are very excited to have you here because we're having some amazing conversations with some fantastic leaders that are painstakingly shaping and reshaping the future of healthcare. We happen to be really passionate about a few different areas. We're passionate about access, we're passionate about leadership, innovation, adoption, and if it's your first time tuning in, let me just sort of take a quick step back to share a little more about what's our focus? What are we trying to do here? So, we're focused on bringing stories of innovation within our space to life. These are real people that are really innovating on the front lines, making things happen, whether it be with services, technology. We want to give them the platform to be able to share their stories with the world. Not just the wins, because there's that sexy side of innovation that talks about all the wins, but also some of the learnings and how are people dealing with setbacks. And if you haven't had the opportunity to check out any historical interviews, make sure wherever you are, just hit the subscribe button now, please, so that any of these new interviews come directly to your inbox and you can learn, continue to apply. So our field, as you know, it's constantly evolving. Things are changing, things are moving quickly. And it's important to be able to connect and collaborate with leaders that are envisioning the future differently and that are embracing innovation. And they are working feverishly to address these pressing challenges. So my next guest, the guest on the show that we're going to be talking about, is a visionary leader who's doing work to really transform rural health. So Jeff Grandia is the co-founder of Redi Health Analytics, where he's making a huge impact by using data to solve some of healthcare's toughest challenges in environments that are often underserved and overlooked. So Jeff has really dedicated over 20 years to empowering rural hospitals with the tools that they need to thrive financially. And when many of these hospitals are struggling to keep their doors open, Jeff and his team are really showing the world that the smart use of data isn't just for big city hospitals. It's for every community that needs quality healthcare. And at Redi Health, Jeff isn't just putting out fires. He's really laying down the foundation for a robust, fair, and innovative healthcare system that doesn't overlook rural areas. So his belief is, and he and I align on this, is that his belief is technology is a force for good. And it can help change the way we think about care for all communities, no matter what size or location. So we're kind of going to jam out today and kind of talk about some of the keys to advancing rural healthcare and ways of ensuring that rural communities aren't just left behind in our rapidly evolving healthcare ecosystem. So Jeff, welcome to the show. It's great to see you. How are you?
Michael, thank you for letting us join. I'm grateful to be here.
Yeah. So Jeff, let's maybe take a step back. Your background's fascinating, but kind of taking us back to your roots. Can you maybe pinpoint a moment when you realized that healthcare, maybe even particularly in rural areas, was your calling? Was there a personal story, maybe a pivotal moment that lit this fire within you?
Obviously, in all of our careers, there's multiple pivotal moments that we all that change our direction or help us grow and help us develop. Originally, my background has an association, and my business partner's background. We both are associated with Intermountain Healthcare and Intermountain Healthcare's history, all the way back from the very, very early days of the evolution of the organization and what it was providing. And Intermountain has been a huge innovator for decades around helping clinicians actually harness data and help use data to drive clinical quality improvement, financial improvement, operational improvement. Most of us probably know a guy by the name of Dr. Brent James, who has influenced many of our careers and many of our guidance. And through that life of Intermountain and the connections at Intermountain, a company was formed or spun out called Health Catalyst to really
Hmm.
commercialize the whole mindset of clinical quality improvement, of helping organizations rationalize the data that they have access to. And in 2019, we went public, and it was all that excitement. But the public markets really did push for kind of going up chain into the top 100 health systems, and in 2020, 2021, my business partner, John Wadsworth, put his arm around me and said, you know, we had so much fun early on with some of these rural facilities, and they really are amazing innovators in the process. Let's go back and do something crazy and help with this methodology and help with this technology growth that we've had and bring it to a rural market. And in 2021, we actually created Redi Health Analytics. And with that mindset of bringing population health and clinical quality improvement and others to rural healthcare. And at the time, people thought we were nuts. But hey, rural healthcare can't afford this. Rural healthcare doesn't have the resources to do this. What are you doing? And I tell you that because we did think we were bringing this really special sauce to rural healthcare, and we received a big grant from the CDC and from the state of Utah to help rural hospitals in Utah prepare for population health. We thought we were so smart. We had all this technology, we had all this resources. We were trained. Our background was training from Partners Healthcare and how that methodology really worked. And we went to all rural hospitals with this, hey, it's free. The federal government's paying for this. We have all this expertise. Let us work with you. And when we walked in, we had 0 organizations sign up with us.
0?
0. And foundationally, they came back to us and we said, we got to reevaluate this. And the reality was these rural hospitals were struggling so much operationally and financially, saying, wait a second, preparing for population health in 2030 doesn't make any sense to us. We're worried about the next 18 months or 24 months. If you can help us with data to help us become more financially solid, to help us more our operational efficiencies, then we want to talk to you. But we don't want to talk to you anyway. So we went back to the state of Utah, to the CDC, and said, hey, this is the approach we're going to take with this. Can we work through the process? And it was really interesting. We then did interviews with these hospitals, and one of the first hospitals we interviewed with said, hey, if you were looking at data, what's the things that you'd like first? We talked about all these financial excitements, but the first thing the hospital said, this is a 17-bed hospital in rural Utah, who said to us, I just would like a census report that's accurate. And wait a second, a census? Can't you walk around the hospital and just count 1, 2, 3, 4, 5, and there's your census report? I said, no, we've been trying for 18 months to get an accurate census report, and it was impossible. If you guys think you can do that, then I'll talk to you about some of this, but I don't think you have an ability to rationalize my data. And John, as we were sitting in a meeting, and he said, this was Tuesday morning, and he says, by Thursday afternoon, I'll have you a census report. And the guy said, there's no way. It will not happen. And our background and expertise around data analytics and building those kind of reports for truly decades in the process made it very quick. And we actually gave the first conversation Thursday afternoon of here's your census report. And it took about an hour to validate that it was accurate. And all of a sudden, this CEO realized how important their data is and how easy it is to improve the efficiency. And what was amazing is then it said, can you help me with my charge master? Now, if you look in the market today, everybody will tell you charge masters have been solved. There's so much technology, there's so many resources. In rural healthcare, charge masters are a struggle everywhere. And in 8 weeks, going through as an analytics company, we're not a rev cycle company, but bringing that in front of the organization and helping them rationalize the data, we uncovered $750,000 of new revenue that year through their charge master. Then you evolve into denials. Then you evolved into contracts versus actuals. And as an analytics company sharing that insight, all of a sudden establishing that financial foundation, then you can start talking about clinical quality improvement. You can start talking about population health because they've now built a financial foundation. That really has been the development of where Redi is today. It's helping first, let's establish financial sustainability and financial foundation, and then let's get to work to really do the work to improve the quality of healthcare that's delivered rurally. That's kind of how we
What
started,
a
and we made a lot of mistakes in the process, but we're really excited
what
with
an
where we're at.
interesting, fascinating story. It sounds like you and the team are pretty good problem solvers, and you have a knack for wanting to solve problems. And at the same token, you realize listening to the market and how they were sharing some of their issues, and then just having the know-how to go back to some of your funding sources and say, "Hey, yeah, we want to do this, but here's the thing. These folks have a bleeding neck problem, and we're talking about healing their toe that's hurting, where they got a bleeding neck problem. We need to sort that out." Have there been any other bleeding neck problems that you have seen surface thereafter, or do you consistently see a consistent pattern across all of rural healthcare? And if so, what are some of those patterns that have emerged?
So, Michael, the theme of that you presented over and over again is real people really innovating. And
Yeah.
in rural healthcare, the innovation in rural healthcare is so much greater than everywhere else in healthcare. And
So
the
much
re
greater?
the reality is people that are working in rural healthcare, that are providers in rural healthcare, get to see the lens of how healthcare delivery is managed. They have 15 hats that they wear. And so when they go through the process, they understand the delivery. When you talk about the top 100 health systems, people are so specialized that they don't get their eyes on the broad swath of how the delivery of care is provided within the organization.
Hmm.
So in rural, what's exciting is once you can actually present data to them and inform them of, hey, this is what's really happening in your organization based on the data, their excitement and their ability to innovate and create new processes and to solve problems is so fast. And it's so exciting. Here's a perfect example. Another rural hospital on the clinical side uh, with surgical site infections. All of a sudden, had a chief nursing officer who was over their quality of this little rural facility said, "Hey, can you help me? We spend we have like 3 or 4 nursing resources every month going through all of these manual reports to try to figure out where there are surgical site infections occur and report on them."
Hmm.
And it just kills us operationally and financially to dedicate that kind of resource for this report. Can you help us with that? We jumped into the process. It was like a 4 to 6 week project to actually build an automated dashboard. And all of a sudden, we sit down literally at the very beginning just to validate this. And all of a sudden, that the chief nursing officer says, whoa, wait a second. Why do you think this person is a surgical site infection? Why do you believe that there's, like, well, here's the clinical evidence and here's the information. And
Hmm.
this is how we came up with it. Why is it?
Hmm.
Well, wait a second. This individual's still in the hospital. Let's walk over there. We walked over, met with the physician, said, "Hey, here's the data, here's the information," and all of a sudden the physician just, "Oh my gosh, I didn't see that." But now you presented the data. Let's go to, and we changed the protocol with this patient, and now you avoided a readmission, you avoided pain and suffering, you solved that, and it was done right on the fly. In a much larger system, how long would it have taken to go through that process where you're affecting a life with that data? This happens every day in health systems. And you brought up a point. One thing I would say about Redi, Redi is not a technology company. Redi is a services company. And it grew because of those top 100 health systems. When you think about 10 years ago, what was going on, this huge acquisition binge. And big system, and it's still going on today, as we all
Yeah,
know.
it's still
But
going on.
and all of a sudden, we had contracts to report on population health, to report on quality, to report on financial performance. Well, when they acquired so many hospitals and so many clinics, we had to integrate that data very rapidly. And now all of a
Mm.
sudden, you're dealing with the integration of Epic, Cerner, Meditech, Allscripts, McKesson, whoever. And through that integration, that allowed us to really learn the patterns of how these data systems work. So now going into a rural facility, like we talked about with a census report, coming together and say, it doesn't really matter which EHR you're working on, it doesn't matter which financial system. We've probably had the experience through our history of pulling those from those systems and now putting that data together and informing you of that. That was the blessing that we had through our history. And it's really helped in rural healthcare as they're all trying to rationalize their data.
Yeah, but the thing is it seems as though that you've got this series of principles that you operate off of. And regardless of, changes that are happening in this world, that those principles don't actually ever change. And we talk about innovation a lot, and just sort of given your background and coming through Intermountain. Intermountain is known for being innovative. Um, innovation isn't free. There's always a cost. And I'm just sort of curious in your roundabouts, what's like the most significant sacrifice that you've made for the sake of, transformative ideas? And would you do it all over again?
Well, first, would we do it all over again? Absolutely, because it's that much fun to go work in these facilities that are doing so much good for these communities. Think about if a rural hospital closes, what happens to that community? If we can help build sustainability in that process, and we are so excited to be part of that, and they're so excited to work with us. It's been a fun experience. Um, the reality of the opportunity is so big, and it is so great for everybody to put their arms around that when you walk in and inform them that, hey, the data is available, the resources are available, let's go solve a fundamental problem. And by the way, we're not asking you to spend millions on technology. In most cases, we're not even asking you to spend tens of thousands of dollars on technology. That's really been the big change for us. We we often tell people who have offered to invest in our company or to grow, we just say, hey, we're a terrible company to invest into. And the reality is, we don't really have a clear exit strategy. You don't really have our price point is so low, and that's what this market really needs. In almost all situations, we guarantee 2-to-1 returns, and we think everybody should kind of do that. If you can't generate more revenue than you're costing in this mix, specifically in rural healthcare, they probably can't afford you.
Hmm. So you know what's going on inside the mind of the customer. And you mentioned that rural health has been some of the most innovative folks you've ever come across and work with. There's something to be said about innovating within constraints. What is it about that makes it so ripe to innovate? Is it because they're just not a choice? Can you maybe try to put your finger on it?
Well, one of the biggest things that's happened on the financial side for us is denials work. Think about how many organizations are struggling with their denials in the industry. I mean, it's almost become a buzzword in healthcare right now, trying to
Hmm.
manage denials. You walk into any rural facility and say, how big is your denials problem? I would dare say very few of them could actually put their arms around. They know there's a problem. They have no idea really how big that problem is. They just assume it's pretty big.
Is
Well,
it a talent problem that doesn't allow them to know that? Because it seems as though that they're sitting on this big asset of data and information. Is it the skill set? Is it the process? What is it that doesn't allow them to really wrap their arms around how big that issue is?
well, think about in a big system, think about in an insurance company, how many people are managing that part of the process of their business? You go into a rural facility and now you have two people.
Hmm.
And I think they have the skill sets or they have the ability to learn the skill sets pretty quickly. The challenge is they just don't have time and resource. It is, hey, I'm overwhelmed with what's coming at me. I'm just trying to stay afloat in the process. And that's where the opportunity that we come in first, it is, hey, let us put our arms around how big that problem is. And let's go talk to the board so that they understand how important an investment is in this area. And let's go do that for, you know, under $20,000 for sure. How many organizations would do that under $20,000? And in most cases, you're defining a 3 to 5 to $20 million opportunity. And it's not, we're not into splitting that. It's not, I'm not here to take any, it's just to help you rationalize how big the challenge is for you. Then it's sitting down because of the methodologies that have been built for years and years and applying, a proven methodology to what that data is sharing and where the gaps are in the processes. And that's why we consider ourselves a services company and not a technology company. It's that approach that changes the processes. It's that engagement that brings value, that generates the income. Most organizations in rural have two major challenges on the rev cycle side. They're given one of two choices. One, go invest in an AI tool that's going to automate this process. They've got a part-time IT director. How are they going to tune that AI tool to their data? Works really well in a big system, but in a small system, they don't have the resources to do that. Or the other choice is just outsource everything to somebody else. Well, then you start dealing with the community's frustration of, okay, now I have a build that doesn't work. Who do I call? How do I work through the process? Our belief is there needs to be another where that expertise, that experience stays in the community. When you think of Redi, Redi is spelled R-E-D-I for Rural Economic Development, and we consider the I being inspired work. But let's keep those high-tech jobs in the communities. Let's keep that experience in the community. Let's not outsource it in any way.
What an interesting perspective. It's very interesting. When you think about the impact of the work that you and the team are doing, I'm kind of going back to when you mentioned we're a terrible team, we're a terrible company to invest in. We have a number of folks that come onto the show. There's one of two paths when you're an emerging company. There's sort of the path where it's traditional, go out, get venture money, whole lot of expectation. And then there's this other path, which isn't, we don't really highlight it too much. And it's interesting to see that you've gone down that path because it appears as though that there's a values alignment that is very important to you, which is to value the customer, to underpromise, to overdeliver, provide exceptional outcomes and results. And that's what's going to fuel the business. There's not too many that are in healthcare, tech, and services that have that approach. Why is that?
Well, I think we fell into it as much as anything. I mean, but the reality was when we started, and rural is kind of in vogue right now with all the dynamics that are going on federally and locally, and rural kind of seems like a good word. When we started Redi, rural was kind of a bad word. And there was very little belief that we could build a business that would be sustainable in this market. And that prevented us from raising a lot of capital and raising and going after it. And the other side was we had to be very conscious that there would not be a really good exit strategy at the time. But if we were passionate enough about this market, would we take the risk? And my business partner said it to me about a year ago. He said, what I'm grateful to say is the experiment is over. The market is much, much larger than we actually forecasted it to be. The need is much greater than we thought it would be, and the innovation is there. And with those three pieces, it allowed us to kind of organically grow in the process. And it allows us to fulfill that mission that we kind of fell into as far as, from an investment, from a strategy standpoint. But we're grateful to be where we're at.
Let's talk about maybe some of the sacrifices and even some of the low points. We're talking about a bunch of the wins Are there any low points that stick out in your mind that are really big learning lessons that you have a willingness to want to share?
Well, there's lots of low points as you're starting a business and figuring it out. Every day is a new day, and you find out you grow more in your mistakes than you grow in your successes. So I'm grateful that we've made a lot of mistakes and learned to a lot of mistakes, and none of them have been terminal in the process. Uh, Probably for me personally, the biggest growth in this process was last year I was diagnosed with cancer, and going through that process of being, and it was a total surprise, colorectal cancer, and it was very late stage. And going through the emotions with my family of, you know, I'm going to live, I'm going to die. What does this mean? What does this mean for the organization? Um, and the reality, once a few people, once you start going through cancer treatments, then you start meeting a lot of people that are in your circumstances, and you see people that are traveling 3 and 4 and 5 hours for care. And, when you have weekly infusions and you have daily radiation, I mean, how do families invest into that? How does rural healthcare? And now all of a sudden, when I hear over and over again this motivation that we need to, reduce services in rural communities and move them all to central high-end facility, that burden for family is through the roof. How do we build sustainability so that we can provide, you know, cancer treatment and orthopedic treatment and some of these things, the specialty care that are needed in these communities, instead of just moving them out and trying to deal with them in major metropolitan areas. That became the major motivation for John and I of, okay, how do we become more of a sustainable force in rural healthcare? And that really did change a lot of the trajectory of our business.
Mm.
Um, I don't know if I would call it a mistake in the mix, but I will tell you it was a painful experience that's caused us to create a lot of learnings in how we actually reformat our business.
Yeah, every business has a story. Yeah, I think about each business, and it's sort of like a movie. And the movie has a really good soundtrack that's attached to it. So, in terms of the Redi Health movie, the soundtrack, I guess I don't know if you're a musical guy, but what songs or music would be on that soundtrack?
So my business partner is a phenomenal pianist.
Okay.
And every time we get together, if there's a piano in a hotel lobby, he'll just sit down and start playing somewhere. We go into a home, it doesn't matter. He can sit down and he can play and for me, the comfort, I grew up in kind of the classic rock. And so I think of those kind of bands that excite me and
Okay.
are part of my life. But the reality is that comforting tune, good show tune from on the piano that a business partner, that's actually the comforting tune of our business. That's
Mm,
the comforting message over and over again at, hey, put our hands on those ivories and we can help you out.
mm, that's so good. I was kind of thinking as you were mentioning it, for whatever reason, I don't know why, but it seems as though you would probably like Journey, Don't Stop Believing. Am I off base there?
That's beautiful. I mean, it's ahead of us, but absolutely. I mean, everybody knows that tune and everybody's living towards that
Yeah.
tune. And I
Yeah.
believe there is a tremendous opportunity for rural to succeed in this uncertain environment right now. And anybody who's giving up believing that there is such a great future for healthcare, excitement for healthcare, and that data is a foundation for how we can be successful, none of us should stop believing in that process. We all should be excited about it.
So what's the best way for folks to follow the Redi Health movie? How do folks get a hold of you? Give us more about where they can go to learn more. Share that with the audience here if you can, if you don't mind.
Well, we didn't challenge, if you can attend rural conferences, what a blessing. Last week, AHA Rural in San Antonio, and you see how rural is thriving in this uncertain market. Redi wants to be part of that mission. We don't see that we are the point of the spear. We're part of the process. But
Mhm.
following Redi, we do a lot on LinkedIn. Michael, we're grateful for your support and education in that space.
Always.
Um, our website, redihealth.com, and John and I would give out our cell phones to anybody to have a conversation. It's something that's we're passionate about, and if you're passionate about it too, link connect with us with LinkedIn, and we would love to sit down with you.
Awesome. All right. So before we wrap up, we're gonna just do a little fun rapid fire, just to loosen it up and end on a really good note. So just kind of makes it a little lighthearted. So are you an early bird or a night owl?
I'm an early bird.
Last book that you couldn't put down.
Um, well, there's a number of them. Uh, Probably Principles from Ray Dalio would be the book that I would say everybody needs to read and needs
It's a
to
good one.
follow.
It's a good one. The one place that you find inspiration.
Truthfully, in my family.
Hmm.
And that's just because of the journey with cancer. And you realize that without a good support system, this life's pretty rough. And it's a challenge for all of us. And to have a good support system around you is the greatest blessing.
Awesome. And maybe an unexpected hobby or interest that you have that people wouldn't think that you had that.
It's interesting that I've been away from hobbies for a little while, and that's a conversation that I've started having with my wife again. And, the hobby that I would really like to get back to, which is the classic for everybody, but it's golf and tennis.
Okay. And because we have an audience that's filled with innovators, innovations about taking action, having a bias towards taking action. If there's one action that somebody listening to this conversation can take and apply, what would it be?
Oh, there's so many. Um, I hope that everybody is taking action to support healthcare in such an uncertain environment right now. I think we have a lot of federal decisions that are being made, a lot of state legislatures that are making decisions right now that are having a tremendous impact on healthcare in general, but specifically in rural healthcare. And I would ask everybody who's paying attention in your community, find out what bills are being passed right now in your community and have a position on them. Because there are a lot of bills that, 340B is a perfect one that's going around the country. That is so foundational for rural healthcare. And so many communities are walking away from 340B. From some of those kind of projects, I would encourage people to get engaged into these decisions so that we're just not slashing and burning and we're being more methodical of the impact of families and impact to communities.
Jeff, it's been awesome to have you come on today and just share a little bit of your story and just even being very vulnerable with your personal journey. And it's great to see you on the up and up and just getting through it. And you mentioned it. It's about having connectivity, support systems. This, in essence, is a microcosm of what healthcare is. Healthcare delivered in a rural setting is a support system. So, for those of you that have been joining in today, found this conversation to be enlightening, insightful, my request, my ask of you is if you'd liked it, would you mind sharing it? Would you mind reacting to it, liking it, sharing with Jeff and whomever, what stood out to you? That would be very helpful. So, until the next one, I'll see you on the next one. Thanks, Jeff. Of
Michael, thank you for letting me join you.
course.